washed my hands and I've put my gloves on, and the baby is in the mom's room. So I'm going to ask the mom to verify the name and date of birth of the infant. Okay. So Rosa, I'm going to assess the baby now. Could you verify baby's name and date of birth for me? Jordan Dormer. There's no date of birth on here.
Yesterday.
8/5 of 16. Okay. All right. Thank you so much, Rosa. Okay, so I am going to take baby's vitals before I do the actual assessment. That way they're not crying and we can get more accurate vitals. So I am going to take baby's temperature, and it is going to be an axillary temperature. The range is 97.7 to 99 degrees Fahrenheit. Looks like little Jordan's is 98.2. Great. Okay, so then I'm going to uncover her for a little bit, and I'm going to look for her respirations. A normal respiratory rate is 30 to 60 breaths per minute. You actually have to assess this for a full minute. You can do it visual or with your stethoscope. Jordan's was about 42 breaths per minute. I also have to do an apical pulse. This is also something you need to do for a full minute. The normal rate is between 100 and 160 beats per minute. An apical pulse is located just below the breast in the fourth intercostal space. Okay, so I listened to this for a full minute, and her heart rate is 148 beats per minute, and her heart tones are regular, and I did not hear any signs of a murmur, which would sound like a shushing sound. Okay, so I'm also going to listen to the baby's breath sounds. The best place to do this is right above each breast. Okay, and then I'm also going to listen to the lower lobes as well. All right, baby sounds good. Okay, I am going to cover baby back up. I didn't hear any signs of crackles, which is good. You don't want to hear crackles in a baby because that could mean they have some amniotic fluid in their lungs. I'm going to take baby's hat off because I'm going to start with her head. Just like a regular head-to-toe assessment, you work your head all the way down. The first thing that I'm going to look for in little baby Jordan is her fontanelles. She should have a diamond-shaped fontanelle on the anterior side of her head, and she should have a triangular-shaped one on the back here. I'm just going to make sure that they are flat and soft. We don't want them to be anything other than that. I'm also going to check the head for any mottling, suture lines. I'm also going to check for any bruising or hematomas or birthmarks. Scratches are also possible. I don't notice anything like that. I'm going to put baby's hat back on because babies get cold very quickly. Okay, next thing I'm going to do is I'm going to check baby's eyes. Babies have the 1/3, 1/3, 1/3. So each eye should be 1/3 and then the nose bridge should be 1/3. If they're any different than that, then there might be signs of anomaly. Is that what it's called? Yeah, okay. Such as Down syndrome or something other than that. I also need to check for an epicanthal fold. This is common in babies with Down syndrome or Asian babies. Next, I'm going to check the ears. I'm going to check the placement in line with the eyes. I want to make sure that the top of the ear is in line with the corner of the eye. If it's down low, that's normally a sign of Down syndrome. I'm also going to fold the ear down and let go to watch for spring back. And I'm going to fold the ear in to check for cartilage as well. This gives you a guesstimation of the maturity of the baby. I'm going to assess the baby's nose. I am going to look for any bruising on the nose from labor, and I'm going to plug one nostril gently and make sure the other one, I can feel air coming out of it. Then I'm also going to do the same thing to the other side. Here I'm going to put my gloves on. I don't have any in here. And this is when I'm going to check the roof of baby's mouth and the sucking reflex. This baby does not have anything wrong with the palate, and their sucking reflex is just fine. Now I'm going to check baby's neck. I need to check this by turning their head from side to side, but first I need to feel for any lumps. So I'm going to gently feel the neck. I don't feel anything. Okay, so now I'm gently going to turn baby's head from side to side. Great. And I'm going to go this way. Great. All right. I'm also going to look for baby's clavicles and make sure that nothing is wrong with them. Bigger babies can have broken clavicles from the birthing process. Great. Nothing seems to be abnormal with that. Okay, now I'm going to assess and undress the baby. This time I'm going to start looking at their skin. While I'm looking at their skin, I'm also going to check respirations and check for signs of respiratory depression, distress. Just kidding, respiratory distress. I'm going to check their skin for any peeling, rashes, birthmarks, lanugo, which is the fine downy hair all over the baby, which is common in preterm infants. I'm also going to check for vernix, which is the white cheesy substance. I will do this throughout the assessment as I look at all of the body parts. Okay, so I've already listened to baby's breath sounds and checked their respiratory rate, but right now I'm going to look for symmetrical. I have to check that first. I'm going to look for symmetrical breathing and make sure there's no nasal flaring, retractions, which are shown in their rib cage, grunting, seesaw respirations, which is when their abdomen and chest rise at different times, and then apnea, which is a period greater than 20 seconds of no breathing. I also need to check for jaundice in the baby, which I should have done with my skin assessment. So to check the baby for jaundice, I can look on their forehead. I can check the whites of their eyes. I can push and release on their chest, push and release on their abdomen, and push and release on the inner thigh. There will be signs of jaundice if there's any yellowish or orange tint when you push down and let go. Okay, so I've already done the respirations and all of that, so I'm going to move on to abdomen. I'm going to look at the abdomen and make sure that it is soft and not firm. I also want it to be flat or slightly rounded. I do not want a sunk-in abdomen or a firm abdomen. I also need to listen for bowel sounds, and I need to ask the mother if they know the last time of their last bowel movement. While I'm checking this, I'm also going to do cord care. Cord care should also be done with every diaper change as well as every assessment. You just dry it, or you just wipe it with alcohol wipes. We do not have any in here. And then you would describe it as moist, dry, or drying, or dry. This one seems to be dry and it is unclamped. Alright, so next I am going to do, you also make sure there's no foul odor coming from the umbilical cord. That could mean a sign of infection. Next I'm going to do the genitalia. This is a female baby, so you want to make sure that the labia majora is larger and covers the labia minora and the clitoris. If it does not, then that can be a sign of a preterm infant. Okay. You also want to change baby's diaper if it's soiled at this point. You want to look for any white or even sometimes bloody discharge from female babies due to sharing mother's hormones. You just wipe it and then it's normal. Okay, so I would change baby's diaper, and then I'm going to move on to the reflexes. I'm going to cover baby up a little bit while I do this. Okay, so I'm going to demonstrate this on my arm because this baby doesn't move very well. So to check for arm recoil, you're going to pull the forearm up for 3 seconds, pull the arm down, and let go, and it should recoil back up towards the body. And then now I'm also going to look for palmar creases in their hands. This baby has 3 creases. An abnormal finding would be 1 crease. That can be a sign of Down syndrome or other issues. You can also check at this point to make sure that baby has 10 fingers and 10 toes. Alright. I think I'm done with the front of the baby. I'm going to look at the baby's foot and check for the Babinski reflex. This is when you take your finger or a firm object and you swipe up on the bottom of the baby's foot and towards the big toe. Their toes should flare and the big toe should go the opposite way than the other toes. Okay, now I'm going to flip baby over. Baby should not be face down, but this one doesn't want to cooperate. Go ahead. Should have took his shirt off before. Okay, now I'm going to flip baby over. And now I'm going to check the spine. So I'm going to make sure that the spine is straight. And then once I get to the base, I want to make sure that I check the base of the spine for no abnormalities, which would include large dimples or a tuft of hair. I'm also going to undo one side of the diaper and check the gluteal smile for hip dysplasia. You want to make sure that both cheeks are equal in size and symmetrical. This baby seems to be just fine. Okay, I'm going to flip the baby back over and I'm going to cover them back up because, like I said, babies get cold easily. I'm going to leave baby's arms out. Okay, now I'm going to check the Moro reflex. You can either do this by slapping the inside of the bassinet, or you can clap your hands by the baby. Baby should adduct and then abduct their hands. And then sometimes their hands will even form a C. So I'm going to clap my hands. Okay, baby, adduct and then abduct. So that is a normal finding. This baby is alert. She is kind of crying throughout the assessment. That's just because I'm messing with her. Most babies don't like it. I'm going to ask the mom when the last stool was, the last void, and the last time they ate. I'm also going to ask if the baby is breastfed or bottle fed. If they're breastfed, they should eat every 2 to 4 hours. 4 hours should be the most for any baby, breast or bottle. Okay, at this point I would weigh the baby. The baby has to be completely naked when you weigh them for an accurate weight. And then when I did the genitalia assessment, this is a female. A male would be different. For a male baby, you place your finger in the inguinal canal area. You push, not firmly, but firm enough, and then you feel and make sure that this testy has descended into the scrotum. You do the same thing on the opposite side. You also want to look for rugae on the scrotum. The more rugae, the higher gestational age or more mature the baby is. At this point, you're going to check the foreskin and lift up the penis to make sure there's no irritation. You're going to slide the foreskin back a little bit, not very far, just enough to see the urethra. You want to make sure that it's center on the tip of the penis and not on top or bottom. And if the baby has been circumcised, you need to assess the circumcision as well. You're going to look for yellow drainage, redness, any signs of irritation that are abnormal. You're going to teach the family about circumcision care as well. Now I'm going to put the baby's clothes back on because it'll get mad and cold.